2010 Highlights of Operations. The great Confucius once said that we have to study our past if we are to define the future. While this philosophy can apply to us as individuals, it can also help forward-looking corporations like ours in drawing the roadmap to a brighter future. As we usher in our 16th year, we invite you to join us as we salute our past. Ladies and gentlemen, this is what 2010 was all about for your PhilHealth. In October, we embarked on a nationwide registration activity to get more Filipinos into our program, taking to heart President Noynoy Aquino's desire to provide PhilHealth coverage to all Filipinos by 2013. We are now taking calculated steps to achieve the goal on time. Along with registering as many Filipinos as we possibly can is our desire to improve on our operational efficiency. Last year, we unified our member registration forms, technically reducing 4 different forms into a single document. Today, the PhilHealth member registration form addresses not only new memberships in any of our programs, but also amendments to our members' records. What comes to mind when people talk about PhilHealth? Definitely medical care benefits. In the thick of news reports about the growing incidence of HIV/AIDS cases in the country, we launched our outpatient HIV/AIDS package designed to help meet the country's commitment towards the United Nations Millennium Development Goals and significantly reduce prevalence rates. We also started paying for outpatient blood transfusion procedures and expanded the P100 benefit for drugs and medicines to all member types. Our total benefit payments to our members for their hospitalization last year reached at least 26.9 billion pesos, a testament to our financial liquidity. We capped the year with the approval by our board of directors of case payments for 11 medical and 11 surgical procedures. This marks our shift in provider payment from fee-for-service to the simpler case payments and jumpstarts our 2011 where providing responsive benefits to our members is concerned. The robust growth in the country's economy augured well for employers nationwide, as well as for self-practicing individuals and voluntary members as our total collections hit the 26 billion peso mark. This is proof of the earnest desire of our members, employer partners, and sponsors to keep their PhilHealth membership status active. We also introduced additional payment windows last year. The long list of accredited collecting agents now include CIS Bayad Center, LBC Express Incorporated, and Security Bank Corporation. At the same time, iRemit expanded our overseas reach, with additional branches now collecting the premium remittances of our modern-day heroes in different parts of the world. To strengthen our overseas presence, we posted a permanent representative in Hong Kong and Macau, countries that are noted for their heavy concentration of overseas Filipino workers. In June, we formally opened our satellite office in Riyadh, Saudi Arabia, to cater to the hundreds of thousands of OFWs working in the Middle East. Soon, we will be in more countries where our OFWs are. It was also last year when we introduced a new payment scheme for self-employed professionals who have been enjoying a premium rate equivalent to what the ordinary voluntary member pays. The new rate now addresses the disparity in income levels and reinforces the responsibility of those earning more to contribute more to the program. Before the year ended, we issued a policy so that only those who are religiously doing their part as members are able to access the medical care benefits. Through the 9/12 rule, we hope to address the pervading issue of adverse selection where members only pay when they expect to avail themselves of the benefits. Two important recognitions gave us reason to smile some more. The 2010 World Health Report of the World Health Organization recognized the country's efforts at expanding various forms of prepayment and pooling to increase financial risk protection, particularly for the poor. Numerous delegations from Asia to Africa also strengthened our position as a model for social health insurance in this part of Asia. On local shores, the Civil Service Commission lauded our efforts to beat bureaucratic red tape. Of 8 priority government agencies they surveyed, we ranked first, a fit truly deserved, considering the volume of clients that our service offices cater to on a daily basis. The healthcare landscape will continue to be very challenging. Enriched by lessons learned from our past, we confidently say that your PhilHealth is ready to embark on an equally challenging journey to bring quality healthcare services within reach of every Filipino family.